So who's important anymore? Is it the doctors, is it the researchers, or is it anyone that is persuasive and reaches our target audience? And if you look at the most popular people in social media and online video, there are patients. There are patients, and they can carry our message because they want to. We don't have to pay them horrific amounts of money to advocate to solve medical problems.
And if you think about a pharma company or a biotech company, we've actually developed these patient and physician association relations type people, the KOL development people, and we have a whole kind of industry around KOL development. So there's specialized medical ad agencies that do this. We have ad boards. So there's this whole structure in place to basically identify the usual suspects, treat them the usual way, and expect the usual results. So what we're recommending here is, the old way to look at KOLs may be a little bit flawed. Certainly we do need the clinical investigators, we need the publishers. At the same time, there may be a physician on Sermo, or there may be a physician who is tweeting that has a much larger following than any of the normal KOLs in any particular specialty.
Quick example, 2 months ago I had a hair transplant. I used to market Propecia.
When's it supposed to kick in?
I had to shave it for a video that Heidi Youngkin, who was supposed to speak now, used at a recent conference because I needed to do a comb-over look to represent a regulatory attorney. But the point is, the point is now that I defy you to go search as if you're looking for a hair transplant and not find my videos or find Dr. Alan Bauman, who did my surgery. And today, this week, he will be giving a hair transplant to another popular YouTuber who's seen, as I am, hundreds of thousands of times a day. So 200,000 people will look at my stupid 800 videos today, and 6 million. And that means that I've got more traffic than most of the health sites that we look at.
So you're more famous when you're bald than when you're not?
It does.
Okay.
It does. It brings out the charm.
Okay, can we possibly get back to the slides?
Well, it's a little bit more about me, if I may. Be sure to tweet at Nalts, and that way you'll be seen by all my stalkers. Here's Happy Slip. One individual that all of a sudden is now got a tremendous amount of reach. Does she have a medical condition that your company solves? Probably. Can she advocate for you? Definitely. Does it mean ceding control of the message? Absolutely not. You can have her shoot a video, review the video, and then have her disseminate the video through her own channel and stop the viral video game where you hope that this production that you've spent $250,000 on somehow goes viral on its own.
Yeah, this woman's also a national celebrity in the Philippines, right? Where she's from?
Yeah, she actually toured the Philippines and brought, she was hired by the Department of Tourism, did a whole series of videos, and it worked. And just likewise, there are now people that are calling off the phone to Dr. Alan Bauman to get hair transplants because I was not ashamed to go out and post a video about it. They can't get a celebrity. I mean, you all know celebrities that have had hair transplants, but they're so damn good you don't know it. So they went for the web-lebrity. And those of us that are on YouTube and don't see any shame in treating our medical condition are out advocating that others consider the same.
Yeah, when I go to the dictionary and look under shame, I tend not to find you.
My picture shows up.
Okay, so let's talk a little bit about online video, which Kevin apparently is also an expert on. So you know what, I'm just going to sit over here while you talk about this slide.
If he starts to yawn, I'll speed it up. Joe keeps reminding me, speed it up. So online video, there's no question, is becoming a significant part of the mix for most companies. But for pharma, not so much so, right? We're still scared. We're still spending most of the time making videos for our own website. Who goes to a pharma website? We need to push our content and our messages out where people already exist, and that's YouTube. And this means, of course, budget shifts, and it's driven by the fact that video, unlike a lot of other forms of social media, Facebook or Twitter, is visceral. It's visceral, it's educational, it's entertaining, and therefore it's persuasive.
Are you finished?
I think so, yeah.
Okay.
Real time, this is your little deal. And there's been some recent news about real-time search that Joe will talk about.
Actually, there is. Anyone here ever heard of Google? Small company in Mountain View, California. Well, they actually just did a deal today with Twitter. Why don't you tell us about that, Kevin?
Yeah, so now Twitter, which is real-time search, right? So when you were looking for Balloon Boy news or Michael Jackson's death, you didn't go to Google, you went to Twitter, because Twitter was always finding the breaking stuff. And Google has been asleep at the wheel in terms of real-time search, what's really being said right now. So through this partnership now, we'll soon, in months ahead, be able to actually query Google for recency. And that means that hot topics can be found very, very easily.
And you saw an example of this recently with Motrin and the Motrin moms, where they had kind of the baby sling, and there was obviously quite a lot of backlash with Johnson & Johnson, but I think we've also heard Mark speak about the speed at which they addressed it, had the ad yanked off the air, tried to appease the community. But it was quite an interesting case study in terms of the immediacy and the power of community.
And Mark, by the way, used to be an issue response. So his ability to reach out to the right person to get the ad pulled was a non-trivial part of that whole thing. It's one thing, yeah, I found it on Twitter. It's another thing to find the person who could pull the ad on Monday. And when we found out about it Saturday evening. So there's a whole sort of process and people side to this thing that is as important as the technology.
And you've also all heard that monitoring on a regular basis is important. We're not going to belabor that point, but certainly if you have a dashboard, if you have some systematic longitudinal way to kind of check in on the communities, check in on the pulse of your brands, that's certainly something you should consider setting up.
If you're still doing, by the way, buzz metrics, which I encourage you to do, it's the first thing I did when I took on Propecia. But then, of course, all pharmas got a little scared, legitimately, of surfing for content about their brands because of fear of AEs. Let's stop that today. I mean, we've heard a number of people from AstraZeneca and J&J said that when they started to monitor, the world did not end. There's a process and a policy. If 4 pieces of information exist, then we route them to the call center. It's not that complicated. It's just not that complicated. So this red herring has to end. This cartoon is my parody of what I see as a legitimate fear from companies that are concerned that social media will open us up to information we don't want, that will become discoverable, bad news. Well, guess what? The automotive industry and others have gotten over this. They didn't want to hear about problems with driver's side airbags, but they managed. And so what I'd like to advocate today, and this is where my message begins, is that if you're in
Wait, is
healthcare,
this the Twitterable moment?
This is the
Okay, let me
Twitterable
step
moment. If
aside.
you can get this into 140 characters, God bless you. Raise your hand if your full-time job is to discover great new medicines. Okay, now it doesn't surprise me that hands went up because I like to think that they're in the labs right now, not working on another PPI or another allergy medicine, but something vital and important. And those people aren't at this conference. Raise your hand if your job is to help patients find life-changing or life-enabling medications. Okay. If your hand didn't go up just now, then you're either in 2 camps. You're either helping those 2 or you're dead weight on the system. You're dead weight on the system. Because the drag in healthcare is everything that's not either developing great medicines or bringing them to market. And so what I'd like to propose is that we really rethink our work and say, is it to enable patients to find great medicines? And if it's not, choose another industry or go get a degree in science and start to develop some.
Are you going to do it?
No, I can't develop
Oh, that was
medicines.
it. I'm sorry. That was your
I'm
moment. Okay.
I'm a pitch man for meds. I like to think my life work is not about fart videos, although that's what I'm best known for. But I like to think that this convergence of social media, video, and healthcare is extremely important. There's a little movement forming. How many people are sort of part of that sort of, we're going to start Twittering, we're going to start monitoring movement? Are you in it?